Good morning, and welcome back. For those of you who missed yesterday, let me tell you what you missed. Just a short recap. The Wonder Woman of the state of Michigan, our Governor Gretchen Whitmer, she came and she gave us a call to action. And she shared with us not to falter in our resolve to address this opioid epidemic. Sheriff Lamont said that he talked about community engagement and the power of that community engagement that changed things in his county in Florida. But he also shared how greed and disdain motivated those who had taken an oath not to do no harm. And then we had Ken Daniels, and we felt his pain as he shared with us the story of the loss of his son. And then we had Mr. Dewberry, who instructed us that harm reduction was one of those pathways to treatment and to recovery. So there was a lot that was packed into yesterday, and I'm sure that we are going to have a video or we're going to have PowerPoints available for those of you who did attend and for those of you who are just waking up this morning and joining us. We still have an information-packed day today, so welcome to our 5th annual Opioid and Substance Use Disorder Virtual Summit, Engaging in a Time of Crisis. And indeed, we are in that crisis. I would like to bring on one of our co-presenters from the Greater Detroit Area Health Council. Kate, are you there?
I'm here.
All
Good
right.
morning, Dr. Dudley.
Good morning.
Yeah, welcome. So welcome, everyone. I'm pleased to welcome you back. I appreciate the awesome summary from Dr. Dudley about yesterday. It was just an emotional day. The stories, the calls to action, it just was heartrending. And really appreciate that. And of course, we certainly appreciate Dr. Dudley. What an awesome sponsor chair you have been for this event this year. Thank you so much. So welcome to everyone. Again, if you missed yesterday, you missed a very powerful day, but we've got a lot on the agenda again today. So we're looking forward to having you here. Before we start officially, I'm going to take 1 second here for a personal announcement. I'm wishing my daughter, Devin Parrott, a happy 29th birthday. So shout out to my baby. Anyway, so let's move on. We're going to identify and thank our generous sponsors. Without these sponsors, this would not be possible. Our associate sponsors, Alkermes, Delta Dental, Orexo, and St. Mary Mercy Livonia. Thank you. Our community sponsors are Ascension Health, Beaumont Health, Community Health Awareness Group, GrowthWorks, and Henry Ford Maple Grove Center. And our table sponsors, our virtual table sponsors, Access, Elmhurst Home, Hygera Health, and the Guidance Center. And our virtual booth sponsors, and please make sure that you visit these booths today. We have time carved out for you to be able to do that. And again, this would not be possible without our virtual booth sponsors and all our other sponsors. So we have the Alliance of Coalitions for Healthy Communities, Detroit Wayne Integrated Health Network, Families Against Narcotics, Fight for Wellness, Gdac, Mariners Inn, My Care Health Center, the Center for Urban Youth and Family Development, the Guidance Center, the U.S. Food and Drug Administration, and Wayne State University Center for Urban Studies. So again, thank you to our virtual sponsors. Thank you to our table sponsors and our associate sponsors. And again, please take the time and visit the sponsors when you have an opportunity today. So I'm going to introduce you to GDAC, the Greater Detroit Area Health Council, and talk to you a little bit about our initiatives and our work that we have going on around the substance use disorders. So let's start with just a brief introduction. GDAC was formed in 1944. So think about that, 76 years ago. We serve as Southeast Michigan's trusted health and healthcare convener. We primarily serve what is known as Prosperity Region 10, and that is Wayne, Oakland, and Macomb counties, and includes the city of Detroit. Next slide. We partner with those who get care, give care, and pay for care with the intent of improving health outcomes across Southeast Michigan. And I'm on the right-hand side here, you see a list of some of our projects and initiatives. And I won't go into this, but this is available for you so that you can look at later to see the wonderful things that we are doing here at Gdac. Again, looking to improve health outcomes. Next slide. Our vision is healthy people, healthy community, healthy economy. And our mission is to work together with partners to empower and improve the health and economic vitality of individuals, organizations, and communities. And we do this by catalyzing the power of collaboration. And you know, health and economic vitality are really closely tied together. And so we come together to try to make the community better. This chart looks at what are the problems that we're trying to solve. They're basically around access, equity, cost, and waste. But you know, I think many of you know that healthcare delivery is siloed and convoluted and lacks coordination. So we need to fix that. Healthcare is definitely not affordable. There's so much waste in the system. This puts a strain on the economic vitality of our region. Michigan ranks among the worst states in the country in terms of health outcomes and behaviors. We actually rank 43rd out of 50 states in terms of health behaviors. So we really look at how can we improve the behaviors of people so that people are making wise health decisions. We also don't integrate social determinants of health into healthcare delivery, and that's something that we need to be able to do, recognizing that, of course, social determinants of health contribute about 80% to health outcomes. And then we waste limited resources across the community when we have duplicate initiatives that are not coordinated. So these are some of the problems that Gdac looks to address. Guess what? We can't do this in a vacuum. Every single one of us has contributed to this problem. I know it's easy to say, not me, I didn't have anything to do with creating problems, but believe me, the way that the system is convoluted, every single one of us has, and we need to work together to fix these issues. So this is a summary chart that looks at our vision, mission, core values, and desired outcomes. I won't go into this, but again, it's here for informational purposes. Next slide. So you recall I had this slide up earlier. I want to focus right now on that little turquoise quadrangle, whatever you call that. What is it? Six-sided. So anyway, if you see the arrow there, and that is really facilitating a community response to substance use disorders. That links us into the importance of this event. Next slide. So we have an organization, a committee called CMAC, which is the Southeast Michigan Alliance for Addiction-Free Communities. This is a community collaborative, and it's dedicated to addressing substance use disorders, and is founded on the belief that together we do more. CMAC is chaired by Judge Linda Davis. It includes more than 25 participating organizations. It's a broad coalition of healthcare, government, business, and nonprofits. It works to address prevention and treatment of substance use disorders in Southeast Michigan. We are breaking down silos between communities and creating opportunities to collaborate on meaningful programs. And so when I say silos between communities, so as you recall earlier, I talked about Gdac working in Prosperity Region 10, and we have the city of Detroit, and we have Wayne, Oakland, and Macomb County. Well, all these counties and cities have been doing their own thing. And so how do we break that down? How do we say we're going to work across problem solving and fix these issues across the community instead of having every county doing their own thing? And Gdac continues to build this coalition, and we serve as the backbone. Next slide. So we focus in 5 areas: education, patient barriers, stigma reduction, navigation of resources, and advocacy. Let's look at education. What are we doing? We're developing an employer cohort to provide educational opportunities and guidance to address substance use disorders in the workplace. Creating and improving educational opportunities around substance use disorders. Next slide. Secondly, we are identifying and resolving barriers that preclude or limit patients from getting appropriate care. So basically, we're working with healthcare providers to enhance and simplify access to treatment. And we do this through education of providers and streamlining and aiding the referral process. Then we are working to reduce stigma. We heard about stigma yesterday. Heartbreaking stories from Ken Daniels about his son Jamie, about the stigma associated with substance use disorders. This is not something that we should be focused on stigmas. This is an illness that we need to help fix people. And so together, CMAC is creating resources, tools, and educational guides that demonstrate the positive ways to present and discuss substance use disorders and recovery. Fourthly, CMAC is creating tools to increase knowledge of and help navigate resources. We are working to maintain mainstream peer recovery services to provide broader access to proven recovery processes. And finally, and not least, we are being strong vocal advocates for change. Advocacy is very important, and CMAC strives to make sure that everyone is aware of changes to legislation and policies that affect prevention and treatment efforts. So in a nutshell, and believe me, it's far more comprehensive than that. That's what CMAC is doing. This is a list of our members. You can see, as I mentioned earlier, that we cover employers, we cover nonprofits, we cover governmental agencies, health systems, hospitals, pharmacies. We are really a comprehensive effort to address substance use disorders in our community. And we would be pleased if you were able to join us. Reach out and let us know. You can reach out to Nikki Gable. You can reach out to myself. You can reach out to anyone on this list. We're very, very happy to get your insights and your connection and have you be involved. So we're going to move on now. I want to take just one brief minute to acknowledge our partnership with the Detroit-Wayne Integrated Health Network, 5 years running that we've been working together on this very important summit. Also to acknowledge the efforts of Nikki Gable from GDAC. Nikki has been doing an outstanding job pulling all this together. I think this is probably, in my mind, one of the best conferences, if not the best we've had so far. And also to Darlene Owen for her tireless support of people with substance use disorders. Darlene is with the Detroit-Wayne Integrated Network. And again, thank you to our sponsors. Thank you to all of you for attending. And thank you to Dr. Dudley for being our mistress of ceremonies. I hope you enjoy this wonderful day. It's going to be thought-provoking, and hopefully we're going to get to some calls for action and take some movement forward. Thank you so much for being here.
Why, thank you so much, Kate. 5 years, and I think I've been part of every single conference, and I'm excited to be here. Just a little tidbit about GDAC. GDAC was the parent organization of the Youth Connection, and they were the ones who applied for a Robert Wood Johnson Foundation grant, received it, and then kicked us out of the house. But thanks, Ma. You know, it's been great.